What really makes for a healthy heart? I mean, is it just the usual stuff, diet, exercise, or maybe something deeper? Perhaps a philosophy from someone who's spent a lifetime fixing hearts.
That's a great way to put it. And yeah, that's exactly what we're getting into today. Welcome, everyone, to the deep dive. We're immersing ourselves in cardiovascular health and modern cardiology.
And our guide for this is, well, the insights from an extensive interview with a really top-tier, highly experienced cardiac surgeon, decades in the field.
Yeah, our mission today is basically to pull out the most vital pieces of knowledge, maybe some surprising insights, straight from his years of practice and his whole approach to life and medicine.
So you're going to get this unique look at prevention, diagnosis, the surgeries themselves, even the sort of bigger social picture of heart health, all from someone who's, truly seen it all.
Exactly. And just a quick heads up, as per our source material, we're keeping specific names and places anonymous from the country of origin, just to respect privacy. But don't worry, the context and the core insights, they're all here.
Okay, let's dive in, starting with his core philosophy. He fundamentally believes that being proactive about your lifestyle, well, that's just essential for a long, healthy life.
Absolutely paramount. And interestingly, he really zeroes in on nutrition, starting right at the beginning of the day.
Breakfast.
Breakfast. He says it needs to be substantial, enough fuel for the whole day,
Yeah.
physically and emotionally. He even factors in, like, potential work delays. You need that energy buffer. Eating normally, he calls it, but crucially not overdoing it.
I thought his take on lunch and dinner was quite practical, too. Lunch timing might shift.
Yeah, and if it's a late one, maybe after hours in surgery, he mentioned practicing some self-limitation,
Yeah.
saving room for dinner, essentially.
It's not about rigid rules, then, it sounds like. More being mindful.
Exactly. Mindful eating, planning ahead. And, get this, his view on fatty foods. It's quite nuanced.
Ooh, not just avoid all fats.
No, not for healthy people. He says the key is just quantity control, moderation. His principle is simple. Limit only what might actually cause harm. It really pushes back against that blanket fat is evil message we hear sometimes.
Okay, but here's something I found genuinely surprising. The coffee thing.
Ah, yes. The coffee.
This world-class surgeon,
Mm.
he cut it out completely.
Gradually reduced, then stopped altogether. His reason, its stimulating effect, how it spikes the heart rate.
Wow. And he extends that to other stimulants too, like energy drinks, strong teas, anything that unnaturally jacks up your pulse.
It's a really powerful personal example, isn't it? Someone dedicating their life to the heart makes that choice based on its physiological effect.
Definitely makes you think. And speaking of things people believe, what about red wine? The whole good for the heart idea.
He tackles that myth head on, says its main benefit is, well, mood enhancement, not dissolving plaques or anything like that.
So does he give any specific advice on alcohol then?
He does. Very specific. Half a glass for women, maximum 1 glass of white wine for men. He points out red wine is actually physiologically harder for the body to process.
White wine, huh? That slips the common wisdom.
It really does. It highlights the gap between popular myths and, the actual physiological evidence.
Okay, let's shift gears to physical activity. We often hear warnings, maybe don't run every day, it's too intense.
Right. But he counters that. He says daily running is fine if you listen to your body, no shortness of breath, no excessive fatigue, then you're good.
And he gives some heart rate guidelines.
Yep, very practical. Resting heart rate should be around 55 to 70 beats per minute. During a run, somewhere like 130 to 140 BPM is acceptable.
And it's not just about hitting the gym, is it?
Not at all. He's big on integrating activity. Short walks, simple exercises, even gardening counts. Just find ways to move throughout your day.
Okay, this next one feels critical. Rest and sleep. He calls it the most fundamental component of health.
The absolute cornerstone, non-negotiable for him. And his own discipline here is just incredible.
Tell us about his schedule.
Bed by 11 p.m., maybe midnight latest. Wakes up at 6:22 a.m. every single day.
Even though he might be doing, 7 open heart surgeries in a day?
Up to 7, yes. And here's the kicker. He says that physical fatigue actually improves his sleep quality.
That's fascinating. It totally goes against the idea that high stress ruins sleep. For him, the physical exertion helps.
It really challenges that whole hustle culture narrative, doesn't it? Prioritizing deep, consistent sleep is key for his peak performance.
Definitely. Okay, moving on to harmful habits. Smoking. His message is unequivocal, right?
Absolutely. Quit immediately.
Yeah.
And what gives his advice so much power is his own story. He smoked for 30 years before quitting.
30 years. Wow. So he knows firsthand the impact on the lungs, the heart. The link to cancer and heart disease.
Exactly. It completely dismantles that my grandpa smoked till 90 and was fine kind of excuse people sometimes use.
Yeah.
His personal journey makes it incredibly real.
And he touches on alcohol again briefly.
Just reiterates his nuanced view, stressing that overall, living correctly is what matters most.
Let's talk stress. He makes a distinction, doesn't he, between acute and chronic stress.
Yes, a crucial one. Those pre-presentation jitters. That acute stress, not an immediate heart threat, but chronic, constant stress.
Right.
That's different.
And that can lead to actual heart problems.
Yes, he specifically mentions it can lead to abnormal heart rhythms. Things like atrial fibrillation, that irregular, often rapid heartbeat in the upper chambers. He sees a direct causal link.
So managing long-term stress isn't just wellness advice, it's actual heart health prevention.
Precisely. He does mention mild sedatives. Something like Valacordin might help occasionally for anxiety-driven heart rate spikes.
But he's careful to distinguish those from stronger prescription meds.
Very careful. It's about a targeted, cautious approach, not a default solution.
Okay, and another area where he pushes back against trends? Supplements.
Oh yeah, big-time skepticism there, especially for routine use in healthy people.
So he doesn't take vitamins, omegas, statins?
Nope. He prefers getting nutrients naturally, from fruits mainly. He voices doubts about the actual composition, the effectiveness of many industrial supplements.
It's a philosophy grounded in natural processes, isn't it? Kind of challenging the whole supplement industry.
Very much so. And it feels like all these specific pieces of advice, diet, sleep, stress, supplements, they all tie back into something bigger for him.
A broader philosophy of life, as you mentioned earlier, which kind of leads us into understanding heart diseases beyond just the obvious symptoms.
Exactly. He talks about sudden cardiac death, for instance. He stresses it's actually quite rare.
And the causes are varied.
Very individual, yes. Congenital issues can play a role. But interestingly, he highlights excessive strong alcohol consumption as a significant documented factor in quite a few cases.
That's sobering. What about that phrase he used, 20-year-old hearts like 60-year-olds? What's going on there?
Okay, so this happens with certain heart defects, especially those causing blood shunting, basically blood flowing the wrong way between chambers or vessels. This lack of oxygen makes the heart enlarge rapidly, the tissue degenerates. It becomes much less efficient.
Sounds serious.
It is, but thankfully, he emphasizes these really severe cases are not common.
Okay, here's a diagnostic puzzle piece he mentioned that really stood out to me. Vegetative vascular dystonia, VSD.
Right. He said that diagnosis, which is apparently quite common maybe a decade ago,
Basically gone now.
virtually non-existent in modern practice, according to him. He suggested it was often used as a kind of placeholder diagnosis.
Like for symptoms they couldn't quite explain when there wasn't a clear, serious pathology.
Exactly. We know something's up, but not exactly what, and it's not life-threatening. It really shows how much diagnostic precision has improved. We have better tools, better understanding now.
That's a huge shift in a relatively short time. Okay, let's move into the surgical side. Cutting-edge stuff. Coronary artery bypass grafting, CABG. That's a major operation.
Definitely major surgery. For when coronary arteries are badly damaged, they create bypasses, often multiple ones, using grafts to reroute blood flow around the blockages.
And his center has a specific approach.
Yes, quite specific. They typically perform it on a stopped heart.
Stopped, you mean? The heart isn't beating during the surgery.
Correct. It's temporarily stopped, and the patient is on a heart-lung machine. This gives the surgeons an incredibly still, stable field to work in, allows for maximum precision, meticulous repair, restoring the anatomy under direct visual control.
Wow. And recovery.
Avoiding strenuous activity afterwards is key. Repeat operations. He says they're rare, usually only needed if atherosclerosis progresses and damages new vessels over time.
What about pacemakers? We hear about those quite often.
Yeah, they're essential for patients with arrhythmias, those abnormal heart rhythms, to ensure the heart contracts physiologically in the right rhythm.
Any precautions for patients with them?
The main ones are avoiding heavy lifting and being cautious around strong electromagnetic fields. Think airport security scanners, maybe some subway systems.
Why the electromagnetic fields?
Because the pacemaker senses electrical signals from the heart. A strong external field could potentially interfere with that sensing or pacing. But the good news, the batteries are amazing now.
How long do they last?
Easily 10 to 15 years, sometimes even longer. Impressive tech.
Okay, heart transplantation. He pointed out something really interesting about why it might be less common in his country compared to others. It's not skill, right?
Not skill, not post-op care. Those are top-notch, he says. The main factor, economics, the sheer cost.
So it's a resource allocation issue.
Pretty much. A single transplant is incredibly expensive. So there's this tough ethical and economic question. Spend a huge amount on one patient or use those resources for more common, less costly procedures that help many more people.
That's a difficult balance. But he did say transplanted hearts are successful.
Oh yes, in specialized centers, they always successfully engraft, he assures. And importantly, transplantation isn't the only hope for severely damaged hearts. Many other surgical options offer great results.
Good to know. And what about preparing patients for these big surgeries? Is it very rigid?
It's highly individualized. Diet changes, some light physical activity are usually part of it, but here's where his team's pragmatism shines.
How so?
Even if a patient struggles to make big lifestyle changes beforehand, they won't just refuse them hospitalization. They adapt.
So they might adjust the procedure.
Exactly. Maybe opt for a slightly less radical surgery if the patient's condition hasn't improved enough through prep. It's about balancing the ideal with the reality of patient adherence, always aiming for the best possible outcome for that individual, meeting them where they are.
That sounds very patient-focused. Okay, let's broaden out again. Modern cardiac medicine in his country. He makes a bold claim about the quality.
He really does. He asserts that their cardiosurgical capabilities are absolutely on par with Western standards. In some areas, he even suggests they might surpass them.
That's not something you hear every day. What does he attribute that to?
Superbly equipped centers, highly qualified specialists. He mentioned some top centers hitting nearly 100% survival rates, even after really complex operations. Precise diagnosis, thorough prep by the anesthesiology team, and surgical mastery are key.
And the access. That's also remarkable.
He calls the fact that care is free ideal and globally unique, and it's having a real effect. Fewer patients, even wealthy ones, are traveling abroad for treatment anymore.
Because the quality is right there and it's free.
Exactly. Why go elsewhere? It's a pretty compelling system.
But if the care is so good and it's accessible, why isn't this more widely known? He mentioned a gap.
Yeah, the public awareness gap. He feels there's just not enough public knowledge about these advanced capabilities. It points to a need for better public health communication, really. Let people know it's available.
And what about trusting your doctor? Especially with something as serious as heart issues.
He offers strong reassurance there. Says in at least 99% of cases, patients can trust the diagnosis. Modern diagnostics are just that highly developed now.
99%. That's high confidence.
It is. He adds that patients always have the right to a second opinion, of course. But he suspects, due to the diagnostic precision, it'll likely just confirm the first one. It suggests real standardization and professionalism.
Okay, one last myth-busting point from him. Routine checkups.
Right. We talked about red wine, but he's also skeptical about the need for regular, routine checkups if you're healthy and feel fine.
He doesn't do them himself.
Personally, no.
Right.
He questions their necessity for genuinely healthy individuals. However,
Big caveat, I assume.
huge, any chest pain, any concerning symptoms, seek medical attention immediately. That's absolutely non-negotiable. But for the worried well, maybe routine screening isn't always the best use of resources.
An interesting perspective on resource allocation again. Okay, let's pivot to the surgeon himself. Becoming an expert like him, what does that path actually look like?
It's intense. Medical school, then ideally residency, postgraduate studies, a PhD. Only then do you start doing even the simpler procedures independently.
A long road. But he emphasized it's not just about book learning.
No, he made a really key distinction. Reading textbooks, even international ones, gives you theoretical knowledge. But the deep understanding, that comes from hands-on, practical participation. And constantly reporting back to mentors during residency and postgraduate work. Active, applied learning is everything.
And it's not just the surgeon acting alone in the operating room.
Absolutely not. He stressed that surgical success is a team effort. It hinges on a highly qualified, coordinated team.
Who's involved?
Experienced assistants, a top-tier anesthesiologist managing the patient's stability, a skilled perfusionist running the heart-lung machine. It's truly interdisciplinary. Complex procedures demand that level of teamwork.
He also had an interesting take on medical generations, no new school of doctors.
Yeah, he sees it more as a continuous evolution. Young doctors learn within established institutions from experienced mentors. They build on the accumulated knowledge, benefit from more international collaboration now, but as one evolving tradition, not a radical break.
Okay, the ultimate question, perhaps. This surgeon, with his insane workload, his decades of high-pressure work, what's his own secret to longevity? to staying vital. It's clearly not taking lots of holidays.
This was probably the most revealing part, personally, his secret. He finds rest in his work.
Rest in work. How does that work?
He's constantly engaged, writing articles, editing books, fulfilling professional duties. He prefers that intellectual activity, that sense of purpose, to being idle. True, long breaks are very rare for him. It's like an active rest.
That's counterintuitive for most of us, I think.
It really is, and it leads directly to his most profound philosophical point about living a long, healthy life.
Which is?
He says the most important thing is building a system of your life, defining your aspirations, figuring out how to achieve them, adapting that vision as you go.
So having a strong sense of purpose, knowing what you're aiming for.
Exactly. Knowing what you will do tomorrow, as he put it. That significantly contributes to longevity. Finding your true path isn't just about happiness, he believes, it's fundamental to health. It reduces that chronic stress, fosters deep psychological well-being. It's almost existential.
Wow. So after all the complex medical insights, the surgical details, what's his final, most concise piece of advice? The thing that saves more lives than any pill.
It's incredibly simple, just 2 words. Live correctly.
Live correctly. Straight from a cardiac surgeon who's seen it all. So recapping, we've journeyed through the huge impact of disciplined lifestyle choices. Sleep, diet, no smoking.
We've seen how advanced cardiac care really is, the skill involved, the teamwork,
Learned about trusting the professionals, the high diagnostic accuracy.
and maybe most unexpectedly discovered the profound role of purpose, of having that system of life in fostering longevity and well-being.
His final advice, live correctly. It sounds so simple, yet holds so much weight after everything we've heard.
It really pulls it all together, doesn't it? From the daily choices about food and rest to the big picture of why you get up in the morning.
So the question for you listening right now is, what does live correctly actually mean for you? Beyond the specific medical tips we discussed, how can you apply that deeper philosophical insight to your own daily choices, the structure of your life, for your own long-term health and well-being?
Definitely something to chew on until our next deep dive.